Healthcare workers have been in constant danger of infection during the COVID crisis. Through the simple act of breathing, a sick patient's respiratory droplets are being expelled into the air.
The risk of exposure has made what we call aerosol-generating procedures, or AGPs, almost impossible to perform safely. Many times these procedures are the difference between life and death in our patients.
The added risk and stress to our healthcare workers is frightening and unacceptable.
I cannot lie, it's scary. People are doing chest compressions and you are on the head of the bed and you know that everything that's coming out of the patient's chest is going straight to your face.
We know we can do better. Our frontline healthcare workers deserve better.
On a daily basis, hospitals around the world perform hundreds of thousands of aerosol-generating procedures to treat patients, oftentimes to save lives. Even though personal protective equipment, or PPEs, help protect workers, they may not stop or limit the actual problem, which is the particles flying through the air. Negative pressure rooms are helpful in these situations, but no hospital has enough resources or budget available to keep all their workers safe during a pandemic.
Rather than allowing the virus to spread throughout the room, only to vacuum it as is done in a negative pressure room, we developed a portable procedural tent which creates a localized negative pressure environment around the patient. It is intended for use during a broad array of medical procedures while significantly decreasing virus exposure to healthcare workers. The aerosol tent circulates and removes air, including droplets exhaled by the patient, through an attached vacuum motor and HEPA filter before being released into the room. It works quickly and effectively. Patients can lie down comfortably on their backs or in any other position as needed. The see-through plastic helps patients avoid any feelings of claustrophobia. The aerosol plastic tent is single-use and disposable. Replacement tents can be installed in minutes. The vacuum motor can be reused. Most importantly, various ports in the clear plastic provide multiple access points to the patient from all sides. These ports allow additional room air to be drawn into the tent and out through the HEPA filter.
Healthcare workers who may have needed a negative pressure room for AGPs can now perform them in a safer environment. We use the aerosol tent for various procedures in our hospital, and these include heated high-flow nasal cannula, non-invasive ventilation, airway management, extubation, bronchoscopy, tracheostomy, and chest compressions associated with CPR.
So for a patient suspected of being infected, it provides an immediate negative pressure environment.
Healthcare workers will benefit from the air being cleaned before circulating in the area.
The non-patient and patient trials in our emergency department's critical care area exceeded our expectations. Under simulation using a saltwater particulate generator inside the tent, measurements of air particulates outside of the tent, including near the arm ports, were equal or less than the background ambient air. Additional testing found the tent offers 50 times as many air exchanges per hour as a negative pressure room. The tent is also over 100 times less expensive. We then tried the system on a patient with COVID-19 with hypoxemic respiratory failure. The patient had been on mechanical ventilation for about 2 weeks and required a tracheostomy to be removed from the ventilator. Clinical, nursing, and respiratory therapy staff all found the tent did not interfere with the complex care required and also provided a higher level of comfort and safety.
Because the system is economical and portable, we think it would be perfect for the military, including aircraft carriers, submarines, field hospitals, and tent deployments.
Whether it's a regular hospital, field hospital, an aircraft, or submarine, or in low-resource settings with limited space for emergency medicine, it is difficult to contain aerosols. The aerosol tent allows healthcare workers to perform life-saving procedures without having to worry as much about contaminating themselves or the crew. The COVID crisis isn't over. It's migrating across the globe. Future pandemics may also be coming.
We want to help our frontline workers feel safer when performing aerosol-generating procedures. We are working towards mass-producing this device.
This device works. People can call us. I'm happy to answer questions and talk about our experiences with it.
This device will open the door to revolutionize care in remote locations, contained environments, and economically disadvantaged regions.
To be clear, this is not an intubation box. This features negative pressure to contain and remove the virus. It is a highly flexible procedural platform that allows a high degree of different procedures to be performed and a high degree of flexibility for the provider. It's innovations like this that are going to help the world fight COVID-19 and future pandemics.